start in T-minus 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Hi and Assalamualaikum to our beloved lecturer, Dr. AIDA. We, Group 6, will present case study on topic 9 based on articles North Mississippi Health Services, or in short, NMHS. In giving you a brief introduction, NMHS was founded on 1981. It is a community-owned and non-profit integrated healthcare delivery system that serves 24 rural counties such as in Northeast Mississippi and Northwest Alabama. They provide many types of services such as preventive and wellness programs, hospital-based emergency and also acute care services. With a workforce of over 6,000 workers and 491 physicians, they have received numerous types of awards and recognition, and one of it is Malcolm Baldrige National Quality Award due to having a very excellent performance in terms of quality. They had won this award 2 times, which is in year 2006 and 2012. In answering question 1, the main focus was clearly on the employees. It is because it has placed great emphasis on making the frontline workers to serve as the day in and day out quality drivers of quality. Employees had been recognized for playing a very huge role for the organization to achieve its goal. And NMHS CEO John Hill leadership, it is his job to drive and coordinate the employees. He empowered the employees by creating a good working environment. In doing so, the employees are being given a lot of incentive to motivate them as in to increase their job satisfaction. 2 examples of incentive that be given to the employees is for them being given the opportunity to develop their skills through training, and also their hard work will be recognized and will be given rewards when they achieve their organization's goal. Hence, when employee job satisfaction increase, it will lead to quality services. Secondly, it relates to the criteria of performance excellence, which is strategic planning. Strategic planning interrelated with a good leadership style, and NMHS taught their employees to measure successful implementation of services. This is when they will use the 5 critical success factors as their guide. Whenever the organization wanted to create a new services or programs, it will be done at a one pilot location in which will save a lot of cost. The employees then will study the best method so that the programs or services can then be implemented at other NMHS branch. Thus, by having employees participate during the planning, it will give them proper understanding when they want to deliver the services to the customers, and it will minimize the error to occur. That is all from me. I will pass to the next presenter.
Thank you, NASHATUL AIN, for the insightful information. Next, me, AINNAZURAH, is going to continue her points in strategic planning. North Mississippi Health Services uses the North Mississippi Health Services 5 critical success factors to set goals and measure success. This ensures that their mission, vision and values can be achieved, as well as making sure their focus is not straight, and helps in building the Baldrige culture. The next criteria that caused North Mississippi Health Services to win their 2nd Baldrige Award is customer focus. Under the administration of Karen Koch, they created a system-wide patient-focused improvement department in 2008. This department creates a customer-focused culture and utilizes customers' information and feedback in order for them to make improvements. Other than the criteria, North Mississippi Health Services also set the North Mississippi Health Services 5 critical success factors as a guideline, where one of the factors is service, and it focuses on improving customer service. Customer focus is especially important for organizations like North Mississippi Health Services because their main customers are people with diseases and illnesses who need extra care. If the organizations do not listen to their customers' feedback and complaints, it will seriously jeopardize customers as well as the organization's future. Lastly, it is apparent that North Mississippi Health Center abide to the business results criteria as they achieved the highest band during the assessment for Baldrige Award. This criteria assesses the organization's performance and improvement in all areas.
The Malcolm Baldrige National Quality Award (MBNQA) is awarded to organizations in the United States for their excellence performance, especially for non-profit organizations, health centers, education, as well as businesses. In applying the successful keys of excellence based on the MBNQA, the Malaysian public hospitals have also been providing quality services that are directed to its customers, along with inputs to achieve excellence. Malaysian Society for Quality in Health is a specialist provider of healthcare accreditation programs based in Malaysia. This accreditation offers formal recognition to healthcare organizations found to meet substantial levels of compliance, key indicators, and competence as outlined in the relevant MSQH standards. It also enables organizations to demonstrate the quality and safety of the services they provide, which enhance their standards and quality of services in pursuit of excellence. Continuous quality improvement and ensuring patient safety is a pivotal reason for participating in accreditation, which further helps to establish common national and internationally recognized standards in the Malaysian healthcare industry. For instance, Hospital Queen Elizabeth is a public hospital in Kota Kinabalu, Sabah, has received the MSQH accreditation status. To support the eligibility of the hospital in earning the status, Hospital Queen Elizabeth has been involved in the second Patients for Patient Safety in Country workshop on the 29th September 2014 to develop Patients for Patient Safety initiative at hospital level. Patients for Patient Safety (PFPS) is dedicated to improving healthcare safety through advocacy, collaboration, and partnership. PFPS believes that safety will be improved if patients are placed at the center of care and included as partners in the healthcare management. This initiative revolves around the criteria of customer focus, as the workshop aims to improve the healthcare system by hearing the patients' voices.
Thank you to the previous presenter. Now, let's continue with the next question. In order to achieve the criteria which is under the strategic planning, Malaysia has created the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergency Aspect 3 and Malaysia Strategy for Emerging Diseases and Public Health Emergencies MySEC 2 to ensure that we can prevent, control and respond to ongoing health security threats to ensure that we are always vigilant. The mission and vision of the strategy is to strengthen effective preparedness and provide all of the policy framework and strategies. Next, Malaysia has faced so many diseases such as Nipah virus, Zika virus, bird flu, influenza H1N1 and COVID-19 that really hit people in the world. In the current outbreak, which is COVID-19, Malaysia once become the best country and all over the world were proud on how Malaysia handled the diseases. Malaysia prepared well ahead when the outbreak was ravaging China, with the Ministry of Health MOH of Malaysia on standby even before any cases were reported in Malaysia. The key success that Malaysia have implemented, which is making the Hospital Sungai Buloh become the main COVID-19 hospital and other hospitals to prepare on standby to receive and treat COVID-19 patients, and a lockdown strategy used in stages has proven to be very successful in breaking the chains of the disease. Extensive communication and high legal compliance are also factors that contribute to the low mortality rate in Malaysia. For example, after the hard working from the people, the COVID-19 teams of Sungai Buloh Hospital Selangor received recognition when it received the Global Health Award DHA 2020 recently following its effort to combat the pandemic. And that's all from me. Thank you.
Thank you to the previous presenter. I am Sharifah and I will continue to the last part of our presentation now. Besides Hospital Queen Elizabeth and Sungai Buloh, Miri Public Hospital also celebrated 2 accreditations for quality and safe patient care on the 28th of March 2019.
The director, Dr. Jack Wong Siu Yu, stated that the hospital was accredited with Malaysia Society Quality for Health, or MSQH, for 4 years, from November 15, 2018 to November 14 this year. The hospital is recognized as a hospital which places quality and safe patient care at the forefront in accordance to the required standard. The hospital club, Sepital Sejahtera Club, was established in 2016 to promote healthy lifestyle among the staff and Miri community at a large Baram district with a population of 64,000 in the northern part of Sarawak, and it is one of the most remote areas of the state. The provision of healthcare in such remote areas of Sarawak has always been a challenge due to poor accessibility and high operational cost. Besides, most of the rural areas are served by a network of primary care clinics under the public health programs of Sarawak Health Department, whereas specialized medical care is available in urban hospitals. In addition to Miri Hospital and Miri Health Office staff, the partners include private hospitals, service organizations, and timber and plantation industry players. The smart partnerships and engagement with various agencies have allowed hospital services to be offered to the poor and underprivileged communities in Ulu Baram for free of charge. Miri Hospital's new drive-through pharmacy is the 5th of the state, which the measure is to improve customers' inconvenience as well as to resolve the inadequate parking space at the health facility. The Balqis journey was definitely intellectually challenging as we evaluated our answers to the criteria questions, which also through the rigorous evaluation by an independent board of examiners in 7 areas defined by the Balqis criteria performance excellence, which are the leadership, strategic planning, customer focus, measurement, analysis and knowledge management, workforce focus, and operation focus. The key reason is to achieve sustained performance excellence. It shows that they have a lot of compassion for their patients and customers, that the hospital become transparent and the quality keeps improving. The doctors then know that their patients are well taken care of. At a time when the public is increasingly skeptical of the value of their healthcare, we honor these hospital systems for being role models in providing a high quality patient experience with sustainable financing. We also cannot deny our country's public healthcare system is one of the best overall performance, which reflect a strong preparedness and response level. I think that is all from our group. Thank you for watching, everyone.